morning and welcome back to Preserve Health Talks. I'm your host, Dr. Ira with my co-host, Leah again, and this morning we're pleased to welcome Dr. Andrew McGregor, who recently joined HCA as a plastic surgeon. Welcome, Dr. McGregor.
Thank you very much. I appreciate you having me on here.
Sure. Thanks for joining us on the show today.
So can you share a bit about your journey into plastic surgery, what drew you to this specialty, and what excites you most about it?
So I think what really drew me into plastic surgery, I was actually in my first year of general surgery residency, and I'd taken care of a lot of complex patients. And what really drew me in is I started working with a lot of the plastic surgeons on cases. And I still remember to this day a gentleman that had just a terrible scar after a prior vein harvest that he had to have for a very complex abdominal procedure. And it was just amazing to see how we were able to transform, something that, really didn't seem super big, but was very important to that patient and really made him feel, it was functionally bothersome as well. And, turning it into something that is making it more functional, also more aesthetic, and overall just impacting his life overall, just by doing very small procedures to really make life-changing procedures for patients.
So what made you decide to join HCA, and how does that align with your vision for your career?
So joining HCA, I think the biggest thing is their vision. Obviously, patients come first, and I think I'm a very big proponent of patient care advocacy and putting patients first. I spent 3 years in private practice up in Brevard County, and I really made it a point to really connect with people and really be an advocate for my patients. And I think joining HCA, that just, is going to augment more that this is the most important thing to me as a surgeon and even a plastic surgeon, is putting those patients first and giving excellent outcomes.
Super. So, plastic surgery, it covers both cosmetic and reconstructive care. How do you balance those aspects in your practice?
So I think for cosmetic and reconstructive, a lot of people associate plastic surgery with cosmetic only, but there's a wide variety of reconstructive procedures, and I think how we balance it is a good mix of everything. I think really getting education out for people to know what exactly plastic surgeons do. Reconstructive wise, we do a lot of things in terms of massive weight loss patients for skin removal surgery. We also do breast cancer reconstruction, and also just general reconstruction for prior scars that you've had that are causing functional issues, hand issues, traumatic injuries to the face and the rest of the body. From a cosmetic perspective, obviously, you can definitely assess anyone from head to toe, and, obviously procedures like facelifts, upper blepharoplasties, rhinoplasties, neck lift, breast augmentation, breast lift, abdominoplasties, and then brachioplasties and thioplasties for excessive skin are some of the things that we really cover in the cosmetic portion of this, of what we do as plastic surgeons. So I think it's, for me at least, it's a way to balance it, with 50-50 between reconstructive and cosmetic, and really all of it ties together. So whether or not you're doing a cosmetic procedure, it's still the basic reconstructive fundamental principles that you apply to those procedures as well.
I'm sure that some patients who want plastic surgery probably have some unrealistic expectations and unrealistic goals. They're not happy with the way they look. They want to achieve something that they don't have. What's your philosophy when it comes to helping patients achieve their goals, whether reconstructive or aesthetic, and how do you balance that?
So in terms of I think the biggest thing is setting expectations for patients right away. I always ask patients when they come in if they're doing cosmetic versus reconstructive. But my first thing is, what brings you here and what bothers you? Those are the two things. I think it leaves it an open-ended question for people to really kind of let them tell you what is the most bothersome to them. And in that, they're going to be able to open up things that maybe you can pick up on, whether there might be some underlying body dysmorphia issues, things that you may not be able to help them with. But I think it sets the tone for patients, that it tells them what your realistic expectations are if you're going to have either cosmetic or reconstructive surgery. And also, too, it helps explain for some people that you may need staged operations. Again, same thing for both cosmetic and reconstructive surgery. You may need staged operations. And that sometimes, as long as you're upfront and honest with people in the very beginning, I think that's the biggest thing. I think one of the downfalls that a lot of people have in plastic surgery is they tend to overshoot, and when your expectations aren't met, that's when people tend to become very unhappy with exactly what's happened.
So a segue to that would certainly be, how do you approach then building trust with patients who may be somewhat apprehensive or nervous or have higher expectations about their results?
So I think, again, number one is honesty is the best policy. You have to, number one, like, you will also know too, like, if you're going to jive with someone. If someone's looking for a cosmetic procedure, you really want to jive with that person or have a good connection with them, because no matter what you do, it could be the best result. But if you don't like the person, if your patient doesn't like you, you're not going to have a good relationship. You're not going to build trust with that patient. And I think you really have to find someone who you like as a person, that's going to take you through the whole aspect of your care, from any procedure that you're having. The same thing with reconstructive as well too. But still, I think that's the biggest thing. And I think you have to, again, be honest with people. You have to show them that, if they have unrealistic expectations, or their expectations are high, you have to really tell them the most honest things. And you have to go over also too, same thing, the complications and the things that can happen and the things that you may need to do down the road. Same thing. You'll see a lot of people that go on social media, they'll post a lot of stuff, but I think the biggest thing is it tends to warp our reality a little bit in terms of what final aesthetics are going to look like, how you're going to look day to day as well too. Pictures on social media highlight the best version of you. They're going to pose it in the certain way. They're going to put it in the right lighting. 23 hours a day, you don't look like that. You only look like that for 1 hour a day when you got those pictures. So you have to really keep people kind of grounded in, like, you're not going to look like this 24/7, all the time, but you're looking for basically what result in the end, you're going to be happy with.
So be honest with me, I'm never going to look like Brad Pitt then.
You might be, actually, yeah.
Okay, good. All right.
So plastic surgery is a rapidly evolving field. What new techniques or technologies are you most excited to bring to patients at HCA?
So I think for new technologies, a couple of things on the cosmetic side. Obviously, I think for cosmetic breast, a lot of people have been using absorbable meshes like Galaflex for soft tissue support. It's been in the literature for a really long time, and also too, same thing also with private practice. But I think the use of some sort of soft tissue support with implants or implants and a lift has really kind of evolved and becoming more of the standard in treating patients that come in with, breastosis, especially after massive weight loss. That skin quality is so bad that, you need some extra support. Same thing too, new implants, so Motiva implants are the new kind of textured implants that came out on the market. That's another evolving, again, kind of technology in the cosmetic breast field that we're also looking at as well. And just overall, just highlighting like new techniques. I think the biggest thing for me as a surgeon is always keeping really up to date on what's coming out. Being relevant to the literature, going to meetings, and making sure that I'm keeping up with the times, because the amount of information that you get now is significantly much more as you become a surgeon later on down the road. So I think it's really important just to always continue to keep up with education and keep up with what's going on in your field.
Are there misconceptions about plastic surgery that you wish more people understood?
I think the biggest thing that I wish people understood was it's not all cosmetic. When you say plastic surgery, they just automatically think cosmetic. It's reconstructive. So, plastic surgeons, they go through two different pathways usually to get there. I did 6 years of general surgery first, followed by 3 years of a plastic surgery fellowship. You can also do straight out of medical school, training. So that'd be an integrated pathway where you do 6 years of training right out from med school. And those are the two ways that you can become a plastic surgeon. I think understanding that training can be substantially a lot more than people think. We deal with head to toe traumatic injuries to the face, facial fractures, cleft lip, cleft palates, congenital issues, multitude of skin problems and issues, lumps, bumps, soft tissue coverage for traumatic wounds, for oncologic issues, abdominal wall reconstruction. So I think the biggest misconception is that all we do is cosmetic, which is a very small percentage of actually what plastic surgery involves, that we undergo training for.
In the future, and perhaps the near future, where do you see artificial intelligence influencing plastic surgery and your decision making, particularly in the cosmetic realm?
So I think, then for me personally, I think surgeons still won't be replaced by AI, but I think a lot of the actual paperwork process and the actual standardization and how you see your surgeon, I think that whole process of getting in and being seen by that physician, I think AI will definitely make they're going to automate a lot of those responses, basically, a lot of the paperwork, and I think the overall system process of getting into a surgeon and the post-op care as well, too.
Okay. And your role in contributing to the local community, I think that will probably be enhanced with your work with HCA.
Yeah. So a fun fact, I actually grew up here in Port St. Lucie. And I actually worked at Longwood Regional Medical Center a very long time ago as a pharmacy technician. So it's good to be back in the area. I think really to basically serve the people that I grew up with. And I think that it drives me to basically, build up this community.
And if I remember correctly, your father was the head pharmacist at the HCA hospital.
So he was the pharmacy director at St. Lucie Medical Center first, and then he was a staff pharmacist at Longwood for over, I think, like 30 plus years.
Yeah.
Yeah.
I've known you a long time.
Yeah.
So what advice would you give patients who are considering plastic surgery but don't know where to start?
So I think the biggest thing I say is, everyone says do your research. I think the biggest thing is Google stuff. If you have a question, Google it. I think just getting a basic understanding of what you're interested in or your problem that is going on, whether again it's reconstructive or cosmetic, start looking it up. I think that's the biggest thing, is educating yourself coming in, because the one thing I like is patients that know what they're talking about, but also do have really good questions, because I think it just helps them solidify how they're going to proceed with the next step, basically. So go on. There's so many resources now. You've got the internet, obviously. Social media is a big thing. You go anywhere on Instagram or TikTok, you're going to see anything plastic surgery related. So, you can spend, and I've had patients literally come to me asking for certain procedures that they've gotten all their information from TikTok, all of them. And they're usually younger, but you even see people that come in and they say, I had questions about this and I saw this X person had this X procedure, do you think this is right for me, basically? And I think that's the way that social media is really evolving kind of how we understand and how we're coming into and how we educate kind of ourselves before that consultation.
So looking ahead, what are your hopes for the future of your practice and for the field of plastic surgery overall?
So I think really plastic surgery is obviously one of those fields that always evolves. There's always kind of new technology. There's always new things. I think really to bring it to HCA is really to expand kind of what we do from plastic surgery in HCA, and to really, go out and basically show the community that there's a lot more to offer than what they think.
We've been joined this morning by Dr. Andrew McGregor, plastic surgeon and good friend and community leader. Thank you so much for joining us today on our show, and thank you for watching us. Look forward to seeing you again on the next episode of Preserve Health Talks.
Thank you.